Evening, everyone. Time for the Ognon class. We've been studying, discussing Ognon since 10th April 2020. And we made it a voyage, we made it a journey. And I really feel that we have moved a lot and crossed many destinations like different prefaces, lists and tables of contents, then James Cross introduction, author's introduction, and then we are on the text aphorisms of the Ognon. We finished 1 to 4. Yesterday we started with the next section, that is regarding the knowledge of disease. And in that, as I told you yesterday, it is in the two subgroups. That is the causes of the disease, and that is 5, 6, 7, 8. That is a blueprint of case checking. And 9 to 18, that is regarding the knowledge of disease as per the vital force. That means the dynamic concept of disease and dynamic concept of health and dynamic concept of care. This is what we are going to do in next couple of lectures. Yesterday we read the first aphorism of this section, that is aphorism number 5. We found about the causes of the disease in acute, most probable, exciting cause. Orally translation gives a very good word, occasion. And then in the chronic conditions, we have to go and see, find out, note down the most significant points in the whole history of the chronic disease. This is what we are to look into. Then, knowing the causes, Hahnemann gave 7 points. That is the first one, physical constitution, which is much more important in the cases of chronic diseases. Then next 6 are his moral and intellectual character, his occupation, mode of living and habits, his social domestic relations, his age, sexual function, etc. are to be taken into consideration. So let us go one by one in some of their details. We discussed a bit about the physical constitution. When we talk constitution, a word which is being used very loosely. I always say in our field, we are not very careful regarding the terminologies. Neither we are serious about it, nor any hope that we are going to be meticulous about the terminologies, despite we know that our master was a linguist and he was very particular for these use of the words, terms, and all that. One day we have to really look into it. Now, if you see constitution, I told you in some of my previous lectures, it is something to be called as makeup. And when we are physician, that means the expert of the physics. Physics means the mind and body of the organism. When you are an expert, then it is very well understood when there is a makeup means it is regarding mind and body together. Only thing is that constitution is a word when you use it literally, then it gets swiped sometime with a word called temperament. Temperament again is a word which has almost the similar meaning. What is the difference literally speaking? When you say constitution, that means though you are talking about the makeup of the person, but then your inclination is more towards the physique of the person. Constitution literally used in this connotation. But suppose if you want to indicate, point out towards the mental makeup of the person more than the physical one, then in literature, the other word is temperament. So these two words are very much related and used in a very, very simple way. See, our difficulty is in the terminology. Our job is to note down the symptoms of the patient or the symptoms exhibited by the prover in their own language. It has its own significance that we will be discussing later. But then when you are going to use like this and you are not going to turn it into some kind of terminologies, the symptoms narrated by the patient or the prover, then you become a little bit a literary person. You become somewhat towards the literature side. And such words usage comes. So when somebody says that he is a very sweet temperament, very happy temperament person, his temperament is very happy and gay. Or when you use the word, his constitution is very lean, thin, or his constitution is very flabby, fatty, obese. So now you can make out the usage of the word, but does not mean that in either of the word you are ignoring the other part. In constitution, in makeup, you're not ignoring the mind here. In temperament, it is mental makeup, but then you are not ignoring the physique here. But then you are using the words because the one is prominent, accordingly you used the word. This is the understanding. Now, when Hahnemann is talking here about the ascertainable physical constitution, ascertainable means something which you can determine. Means if you can really say this in certain words, as I told you, that a lean, thin, waxy looking face like this, what is that meaning? That what you can really determine. That kind of things are really important to be noted in finding out the cause of the illness, and that is something very, very important in the chronic conditions. Sometimes some prescribers, especially in Kolkata school, I find these are given, this physical constitution is given a very good and due weightage. But then there are prescribers or the methods of prescribing. There are various methods of prescribing, and every method has got something to contribute towards the mission cure. But I believe that when we are going through the master's expression of the understanding, that is the organon, our case taking and everything must be so. In chronic conditions, this very expression of his physical constitution is very specific. Here he made it very clear that even in constitution it is makeup, covers the mind also, but then he is saying too much of importance given to the physical constitution. Because whatever it is, there are certain things in the physique of the person does not change despite the growth and everything, until otherwise there is some kind of physical accident. So it is so fixed with him. It helps a lot to individualize. For example, whatever is my complexion, until otherwise I do any accidental activity using some kind of complexion treatment, etc., the complexion will not change. My hair, not that much I am talking about the color of it, but then the texture of the hair. The texture of the hair is not going to change so much. So this is all something very important. That is why it is very, very important in every case, whenever is coming to you, you must be looking at the height and the weight. Means how is he looking? Tall person, thin person, short person, obese person. How is he looking? One is the measurement of it. Do the measurement also. That's not really bad. Good. It is going to help a lot. But then in the looks, how is he? In the dimensions of the length and breadth. Then we find the complexion of the person. We find the features of the person. How the eyes look, how the nose look, how the ears look, how's the forehead look, We do look all these things, but then we do not ascertain them, and we are not finally writing it. Even in the presentation of the cases, it is not there, because in the case sheet it is not there. Any case which I have cured, I will be writing it later. But then the ascertainable physical constitution, since I have not noted, I cannot write down, because you just cannot remember like this. So the whole thing is, this is something very, very important. Now, each of the 7 points can be discussed at length. One point is enough for many lectures. The purpose here, what we are doing with the study of the organon, is not to elaborate one point too much and leaving the other point and then going further. No. My only understanding is that if suppose I put before you that when you are going to understand all these 7 points today, what is my point to make it is that literal meaning, how you should understand all these points given here one by one. Once you understand, this is not going to finish the job. It is not enough to know the meaning of it. Like, for example, this physical constitution. We all study Agrawal constitution, and like this, immediately you got the idea. So many of explanations regarding the constitution. Maybe not in homeopathy, maybe some other literature. Like if you go in psychology, you will get all these things. There are aesthetic constitution, there are aesthetic constitution, like this. So many of the explanations, so many of the people, so many of the psychologists especially, they worked on the constitution. We really need to learn. See, in the time of Master Hahnemann, subjects were taking shape. Like I told you earlier, psychology was not established as a separate discipline. It just came